face, some or the other tension or stress during the day, in fact during the week, right? Because that is very normal, that is the normal part of our life. But what is not normal is the intense and excessive worrying and fear which may continue for days or weeks or in fact months together, because this is exactly what is known as anxiety. And if this anxiety continues for long, this may lead to anxiety disorder. Yes, you heard it right. This leads to anxiety disorder. So, hi, I'm Dr. Anju Shukla. I'm a behavioral analyst, I'm a life coach, I'm an NLP coach, and a practitioner. So, today we are just going to talk about few facts about anxiety, because a lot of us are literally not exactly aware what anxiety is, right? And this is an ailment. In fact, anxiety disorder is something which affects 4% of the world population. Yes, you heard it right. 4% of the world population is affected by anxiety, and females are more affected by anxiety in comparison to the other gender, that is males. And apart from this, around say 301 million people in 2019 were affected by anxiety disorder. Anxiety is a fear or a worry which a person may have because of one specific situation, right? Something like panic attacks and everything, or for a broad range of reasons, right, which is very general day-to-day working. So this excessive fear and worry which continues for days together, weeks and months, is something which is known as anxiety. So what are the symptoms of anxiety? When a person feels anxious, the person may lose focus, the person may lose sleep. In fact, the person may not be able to continue his daily working. The person may lose appetite. In fact, the person may have sweating hands when the person is feeling anxious, or probably the heartbeat may go up of a person who is feeling anxious. In fact, there is heart palpitation which increases in a person who faces anxiety. Continuous feeling of irritation, tense and restlessness is also known as one of the symptoms of anxiety, and experiencing nausea or abdominal distress is also one of the symptoms of anxiety. There is a whole range of anxiety disorders, and in my coming videos I'm going to discuss each and every anxiety disorder in detail. For example, if we want to take up the very first anxiety, is known as generalized anxiety disorder, also GAD. The second anxiety is something which is known as panic disorders. The third may be known as social anxiety. The fourth may be known as separation anxiety disorder. And the fifth may be known as specific phobias, which is a general grouping of phobias. And the next is known as selective mutism, and the last is known as agoraphobia. So all these are types of anxieties disorders which have got their own specific characteristics and symptoms, and in fact the treatment of all these is varied because the symptoms are different. So in my coming videos I'm going to take up all these different anxieties in one by one, so that we can understand how one disorder is different from the other. Anxiety disorder, as I said, can always be treated, right? But the fact is that amongst 4 affected patients, only one person is able to get treatment. There are various reasons for it. It may happen that the person doesn't know that the person is suffering from anxiety disorder, or they may keep on ignoring because of various issues like the medical facility is not there, or probably they themselves don't realize that they need treatment, or they don't take this as a very very serious issue. In fact, the treatments can range from psychological steps wherein there is therapy which is involved, and if the case is a little more serious, the treatment can be done with the help of medication also. So anxiety disorders are something which can always be treated, right? But the fact is that the acceptance has to be there that it can be treated and the person needs the treatment, right? So if the person is ready and willing and recognizes that the treatment is something which can solve the issue, only then the treatment can help. The intervention happens at the right time and with the help of right therapy and medication. So everything is treatable, but again the action has to be taken, which is normally not taken, because as the data states that only 1% among 4 people are literally treated for anxiety disorders. So thank you so much for listening to this, and in the next videos we are going to come up and take up each and every anxiety disorder in detail. Hope that helps us all, right? Thank you so much. God bless.